Hi, my name is Rebecca Steele. I am a second degree nurse, so I have a undergraduate degree in biology, and then I got my master's as a clinical nurse leader from the University of Virginia here in the state of Virginia. And I went on to do my work right out of nursing school in the Surgical Trauma ICU at UVA. Learned a great deal there and started to really pique my interest in things related to technology and healthcare while I was in that environment, and found myself wanting to figure out how we could keep patients from hitting that level of care. And so reached out and found an organization in my local community that was doing remote patient monitoring. So joined them and helping care for patients telephonically while they were uploading and sharing their vital signs day to day, doing telephonic assessments, care coordination, teaching patients on their discharge instructions and following up on their care. And then we wanted to create a better interface for the patients to engage. So I stepped into a program manager role where I really helped develop that technology. And then I went into consulting on my own, helping other companies in the digital health space develop their products and tools to better serve both clinicians and patients. And then ended up getting a job here at Echo, where I've been fortunate to be the product strategy clinical lead, and it has been an absolute blast being a part of this organization and developing the product that we get to put out into the world to allow clinicians to have more information through the use of our stethoscope at the tip of their hands, and in order to improve patient care. Yeah, absolutely. So, I think, there's the good and the bad side of technology. If it's done well, I think it absolutely can help nurses care for patients. If it's not done so well, it becomes an obstacle and another bit of a headache in the process of doing what nurses, set out to do, which is care for patients. And so if the technology is, I think most importantly designed with the clinician and the patient in mind, then what we can do is really make room for the nurse or other clinician type to focus on their training, their core training, and really give the patient the attention and time that they need, and not spend so much time in the, data capture necessarily, but really using those skills and putting them to practice by leveraging technology to enhance the information that they're gaining through the skills and the use of that knowledge. So there's so many new things. I feel like this is a little bit of an age of like the Wild West for technology and healthcare, where we're really starting to see that technology is important to allow us to move forward and be more efficient and effective and to reach more individuals, especially as we see more individuals needing care and unfortunately less individuals being in the workforce. So learning how we can leverage technology to enable us to care for many successfully and efficiently is only going to be fulfilled, I believe, through the use of building really smart, wise, and effective technology to serve those clinicians. Yeah, I think as I mentioned, when I was in the ICU, you engage with technology, but I've always been kind of a tech geek, if you will, and looking at new things in other industries and other things that have been designed and built and put out. And those inspire me to think about, well, what could we do for healthcare? Like, how can you find that analogous inspiration and bring it to healthcare to create those efficiencies? And so when I was actually completing my master's program, my capstone was focused on designing and working with a multidisciplinary team to build a ketamine algorithm for burn and wound care, because ketamine, unlike opioids, they don't drop your blood pressure, your respiratory drive, but they can help block pain. But it can help block pain. So my ultimate goal was to create this nurse-driven protocol with ketamine so that the patient could go off into this dreamlike state while you're taking care of their wounds. And then ultimately, my dream was to pair that with virtual reality. So you could literally send them to the beach, right? You see how far virtual reality has come today. I mean, you could do everything from like dancing in the sky to like riding a roller coaster to all these different things that are becoming more and more, immersive. And so how could we take this awful, painful moment in time for an individual going through, a burn or a wound that needs to be cleaned and sending them to the beach or to the ski slopes or whatever. That was my ultimate goal. You can only accomplish so much in a semester, though. And that's really when I think my brain just started turning on like how can we leverage other technologies in healthcare to serve our patients and our clinicians alike. And so have always been kind of along my journey in nursing, interested in seeing where new technologies get implemented and brought into the fold in patient care. Then following in my bedside career, I was fortunate enough to be a part of an ICU that was open to implementing some new technology, and we were rolling out predictive monitoring technology that could help determine if someone was going to go into respiratory failure or have hemorrhage. And so it was eye-opening to see that process come to life. And it really, for me, cemented how important it is to have nurses involved in that process, because at the end of the day, nurses are how medicine happens. Doctors are incredibly talented and they can help diagnose and make sense of the information. But nurses are the one who carry out the orders, and really that's where the rubber meets the road. And so I feel like it is so paramount to include nurses in developing this technology and implementing this technology for it to be successful, to really improve patient care, because we just have a perspective that is unique in the skill set that we've been learned and the closeness and the relationship that we have with the patient and understanding their needs and their barriers to success. So I'm a huge advocate for nurses being involved in the development of technology. So. Yeah, so Echo has